Hello and welcome to Basic Spanish for OT, PT, and SLP clinicians. My name is Juanita and I will be your host. I am an occupational therapy assistant as well as the author of this book, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. I will leave a link on the channel. On today's video, we will continue with basic questions and commands from page 87 in the book. If you have a copy of the book, I invite you to turn there now. If you don't, let me use this time to encourage you to get a copy, as it will make it much easier for you to follow along. With that being said, vamos a empezar. On today's video, we are highlighting a few words from page 87. The first one is escaleras. And that you may remember from the last video, which was stairs. Escaleras is stairs, okay? The next one, timbre de llamada. Timbre de llamada. And that is to say call bell, especially for those hospital clinicians and those skilled nursing facility clinicians. Timbre de llamada is very important, especially at the end of the session. You want to make sure that your patient has it. The next one is medicamentos, and that is to say medicine, okay, medicine. And the last one is the one that makes me smile. It is the word for straw, okay? And straw is a very funny word because there are 11 different words for straw, okay? The one that I gave is pajita. But there are so many other words that you may hear. You can hear absorbente, you can hear bombilla, you can hear popote, you can hear cañita, pitillo. There's so many different words, but the one I tend to use pajita. Or popote is another one that you can use that I've heard used. But for the purposes of the book, I use pajita. So let's get started. All right. So the first one on page 87, do you have steps to get into your house? Tienes escaleras para entrar en tu casa. Tiene escaleras para entrar en tu casa. Last time. Tienes escaleras para entrar en tu casa. Okay? And that is the informal way of saying it. You can do the formal way of saying it, which is tiene escaleras para entrar en su casa. Okay, so either or is fine. The next one, tienes tu timbre de llamadas o llamada. Tienes tu timbre de llamada. Tienes tu timbre de llamada. So do you have your call bell? Okay. The next one is, do you live solo? Do you live alone? Do you live alone? So remember in Spanish, the rules. We talked about the rules of Spanish and the rules of English. And it's very important for you to be reminded that you cannot apply the rules of English to Spanish and vice versa. So in Spanish, there's a heavy use of gender. So they have two genders, masculine and feminine. So if you're looking to use the masculine gender, then you would say vives solo, or you can say vive solo, which would be the more formal way of saying it, vive solo. If you're looking to use the feminine gender, then it would be vives sola, or vive sola. Okay, so that's just something very important to know. And I think I've uploaded, I'm more than sure that I've uploaded the video on the rules of language. The next one is, do you live in a house or an apartment? So, vives en una casa o en un apartamento? ¿Vives en una casa o en un apartamento? ¿Vives ¿En una casa o en un apartamento? Do you need pain medicine? And a lot of times we're asking this question, especially I know in the hospital setting, we try to maybe schedule the therapy session around the time of their medication because they may be in pain, especially in our setting, because we generally tend to see people right after they had an accident, incident, or injury or something. So pain is a real big barrier to therapy session. So, ¿necesitas medicamentos para el dolor? ¿Necesitas medicamento para el dolor? ¿Necesitas medicamento para el dolor? So, do you need medicine for pain? The next one, do you need something to drink? ¿Necesitas algo de beber? ¿Necesitas algo de beber? ¿Necesitas algo de beber? Do you need to use the toilet? So we tend to say, do you need to use the bathroom? Okay, you can say that you need to use the bathroom. So, ¿necesitas ir al baño? So that's really to say, do you need to go to the bathroom? ¿Necesitas ir al baño? ¿Necesitas ir al baño? Okay. And the last one, do you prefer to use a cup or straw? ¿Prefiere usar una taza o pajita? ¿Prefiere usar una taza o pajita? ¿Prefiere usar una taza o pajita? And just remember, be careful. You have to talk to our speech therapist because some patients have restrictions where they're not supposed to drink with a straw. So before you ask that question, you want to make sure that the patient is able to have a straw. Okay? I'm at 7 minutes and 47 seconds, so I think we have time for, do you know what I'm saying? Okay, so let's get started. ¿Tienes escaleras para entrar en tu casa? ¿Prefiere usar una taza o pajita? ¿Tienes tu timbre de llamada? ¿Tienes tu timbre de llamada? ¿Necesitas ir al baño? ¿Vive solo? ¿O vives sola? ¿Necesitas algo de beber? ¿Vives en una casa o en un apartamento? And lastly, ¿necesitas medicamentos para el dolor? We're at the 9 minute and 5 second mark, and I just want to say gracias por venir. Remember to practica, practica, practica as much as possible. Adios. Gracias por venir. See you in the next video. Bye-bye.